Welcome, friends, to LSR Live. I'm your host, Scott Ritzma, and it's a great night together, evening here, Eastern Time Zone in America. I know we have viewers all over the world, and you will not be disappointed by today's special guest, Dr. Wes Youngberg. I'll tell you all about him in just a moment, but the topic is cognitive health and aging gracefully. And so that's something that you might think, well, this is for, I'm going to share this with my senior citizen friend at church or my parent or whatever. But what you're going to hear, it blew my mind from Dr. Youngberg's research and clinical practice on this. This is what he spends 80% of his medical practice on, is cognitive health. And he tells me, and I want him to tell the audience this too, that you need to be thinking about this in your 30s, that the signs of cognitive decline that later come, that these are already beginning at young ages. So there you see it. Lifestyle and nutritional medicine clinic is his practice, the Youngberg Lifestyle and Nutritional Medicine Clinic. He's an expert in natural therapies, and we're talking about how to age gracefully. He's also one of the founding directors of the American College of Lifestyle Medicine, which is the fastest growing field of medicine in America today. And he was the first fellow of that American College of Lifestyle Medicine. So we're very honored to have Dr. Youngberg with us this evening. Thank you to our sponsor, First Things First, and this has been a lifesaver for me lately. Well, not lifesavers. I grew up eating the candy lifesavers. Maybe some of you did that too. When you eat the sugar, you're going to harm your immune system, but when you're traveling or your family's fighting something, you know something's going around, spray that throat with that Revita Guard, get the Revita sinus up in the nasal cavities, and then of course you can use the Revita hands to simply sanitize your hands without using the harsh chemicals and the alcohol-based hand sanitizers over and over again that smell terrible. And I was actually traveling a while back, and I left my Revita sinus at home, and I'm in the airplane in the airport, and I'm wanting to do something to add a little immune boost, the iodine up there, which we've got in our Revita sinus. But I left it at home. So I went to the regular store, and I'm like, well, this one looks like it may be decent. I bought it. I sprayed it up there. I could not stand the stuff. I threw it away. So I'm very thankful for the Revita Living products at the LSR store. Use that QR code, head over there, and support what we're doing here by helping your own immune system be boosted. So, Dr. Wes Youngberg, I am so glad to be talking with you about cognitive health. And I know I kind of primed people with that comment about already in your 30s. And we've got a whole journey of conversation that we'll have. We want to bring people's questions in. But can you first explain that right out of the gates? Why is this conversation valuable for people who are your age, my age, and not just the elderly?
Okay, well, I'm actually starting to get into the elderly category. I'm 64 now, so in a year I'll be on Medicare, and so I'm a little older than you. But the reality is that I'm getting patients now who have more moderate or even advanced forms of Alzheimer's in their 50s. Okay, so this is critical for everybody. But Alzheimer's has now become one of the fastest growing disabilities in the United States. And it's even in some categories, the most common cause of premature death in like, for instance, women, Alzheimer's. Okay, so we know that if somebody's lucky enough or healthy enough to survive until age 85, at least 1 out of 2 of us will already have Alzheimer's by that time. However, if we have a single copy of the Alzheimer's genetic mutation called ApoE4, just a single copy of that from one of our parents increases our risk 5-fold of getting Alzheimer's, but it also increases our risk of being 1 out of 2 having Alzheimer's by age 75, a full 10 years earlier. If we have 2 copies of that ApoE4 mutation, we're now more likely to get that same risk some 17 years earlier than age 85. So a lot of people have these mutations. Now, I want to say, though, The mutations in of themselves don't cause the disease. They just increase the risk. They just make it more likely to occur if we continue to persist in the lifestyle choices that drive the risk. If you live in a house that has a swimming pool, do you have a greater risk or lower risk of drowning, or somebody in your home, a child drowning in that pool? Of course, the risk is high. So we just need to be more vigilant. And as long as we're more vigilant, that risk goes away. So don't be afraid of the genetics. By the way, I do genetic testing with almost all my patients, and I tell them that by knowing where your genetic mutations are, okay, we can actually precisely determine what cofactors like minerals and vitamins and other nutrients are necessary to optimize their health and overcome the risk associated with that mutation. So Alzheimer's risk begins, as you pointed out, roughly around age 30, but people don't notice the symptoms until much later. There are now new blood tests that have just been available for the last few months that can be accomplished by working with your local doctors or specialists in this area that can tell you whether you actually have beta amyloid plaque laying down in your brain. It can tell you whether you have neurodegeneration. That's the second blood test. And the third blood test can tell you if you have inflammation in your brain. We've never had these tests available now. We're recommending, especially people with a family history of Alzheimer's, that they get those tests done sooner rather than later so that we can start addressing the problem now.
I know you've been addressing the problem with many people. How did you first get started focusing on the cognitive health front? I know that your background is in lifestyle medicine, so there's a lot of overlap here, isn't there?
Caught my attention is that I never really was that interested in neurologic health. I was more into cardiovascular health, immune-related health, the digestive health, things like that. Diabetes management. I spent a lot of time specializing in helping people reverse their diabetes or their pre-diabetes. But about 10 years ago, actually in 2014, I read a paper written by Dr. Dale Bredesen, a well-known research neurologist who has spent now 40 years of his life doing research on how to optimize and what to do about Alzheimer's. And in that paper, he took 10 patients who had early Alzheimer's or mild cognitive impairment, and they put them on a comprehensive lifestyle medicine program, and they did quite a few blood tests to figure out what were the underlying triggers or underlying risk factors that were driving their form of cognitive decline. And essentially, they worked at fixing as many of these underlying factors as possible. And all 10 of those individuals had a dramatic, not just prevention of further problems, but they actually had a reversal. In other words, they didn't just stay the same and not progress, but they actually got better. So when you get better from a condition, by definition, that means that you're reversing that in some way. And so that really impressed me. Now, what really got me, and that's why I've been talking about this very passionately for the last 10 years, is that when I read that carefully, I learned that the number one most common cause of Alzheimer's, which is the main form of dementia, and true for other forms of dementia as well, is insulin resistance. And that really piqued my curiosity because I was already an expert in insulin resistance. I've been writing books about it. I've been doing the video series about it. I've been focusing on that for the last 30 years of my practice. And so I said, I'm going to learn more about this. So I signed up for a program where I actually trained under Dr. Dale Bredesen in San Francisco, in Novato, actually near San Francisco. And I learned from him and other experts like him how to apply the strategies in a much more specific but also broader way, using the principles of lifestyle medicine, but also doing some other tests that I'd never really thought of doing before. And so as I started introducing those strategies to my patients, I noticed big improvements in their cognition. Of course, I'd been helping people improve their cognition, through natural things, but it was just kind of one of the normal side effects of treating heart disease or hypertension or diabetes. And so I started talking about it a lot more, and more people started coming to me, primarily because of their concerns about dementia, either early tendencies to dementia, or they had a subjective, they knew that they weren't as sharp as they used to be. They could still communicate really well, they test really well, they get 30 out of 30 on the Montreal Cognitive Assessment. Nobody thinks that they're in any way have problems with cognitive decline, but we know that we're not as sharp as we used to be, and that's the problem. That's a form of early cognitive decline. And then, not to say, now that we have the new blood test available, we can catch it even before there's even any clue cognitively directly. So that's what got me started in this, Scott.
How much of the cognitive decline do you think is due to the lifestyle factors associated with the diabetes, or just if there was no diabetes, how much cognitive decline would be reversed?
Well, let me say that the big issue is not diabetes per se, but the underlying cause of diabetes. So a lot of people have what we call, many people, I would say up to 80% of the population has some measurable form of insulin resistance, okay, which means that now the blood sugars start to creep up a little bit, and then the insulin production by the pancreas has to creep up a little bit to compensate for the resistance to insulin. And so little by little, you have higher and higher blood sugars and higher insulin levels, and that's straining the body system. So in my book, Memory Makeover, How to Prevent Alzheimer's and Reverse Cognitive Decline, I wrote that book, Scott, to give people hope, because a lot of people, they think that once they reach a certain point, it's curtains, right? That it's too late. That they've already lost so much cognitive function that the pathology is already ingrained and there's nothing you can do about it. I remember early on in my training at Loma Linda University, the belief was back in 1985 that once you got heart disease, you're tough luck. You're going to have heart disease for the rest of your life. You can maybe prevent further damage, but you're not going to be able to reverse the heart disease you have. I remember not knowing really much else at the time. I was just a freshman in my professional training, and I raised my hand and I told the professor, who I respected very much, who's a brilliant physician, and I said, hey, I got to believe that even if you have heart disease, any lifestyle intervention that you intervene with should make that better over time. Okay, and my professor wisely, he says, how many people agree with Wes? Nobody raised his hand except my buddy sitting right next to, just as a form of defiance to the professor, right? But now we know, with the Dr. Dean Ornish studies and many other studies, that heart disease is 100% reversible, but you got to do the right thing. Okay, and even Dr. Ornish has published papers now on reversing Alzheimer's. Just read with a big paper on that as well. So the bottom line here is that diabetes and its underlying cause, which is really like a pre-diabetes scenario, or just you can have normal blood sugars or even ideal blood sugars, but you're producing a lot of insulin in order to control that. That's a risk factor for Alzheimer's. So in my book, Memory Makeover, chapters 5 and 6, okay, you really want to take advantage of that, because those chapters talk about how blood sugar imbalances dramatically drive. It's the main driver of Alzheimer's, the most common driver. So high blood sugar is really bad for the brain. High insulin and is really bad for the brain too. You know why? Because the same enzyme that breaks down beta amyloid plaques in the brain also breaks down insulin. And if your insulin is high all the time because you have insulin resistance, then those enzymes that should be cleaning your brain from toxins and plaque are instead basically breaking down insulin because it's too high. And then when you have high insulin, you end up having low blood sugars because what goes up must come down. And now you have this roller coaster of blood sugars. High blood sugar is bad for you. Low blood sugar is bad for you. High insulin, bad for you. And then the cortisol shoots up because it's trying to get the blood sugar back up. Now the cortisol level is bad for your brain. So you got 4 things that are really bad for your brain when you have problems with insulin resistance. And so that's why the lifestyle intervention strategies, the proper sleep, proper exercise, proper diet, proper exposure to sunlight and fresh air, all the natural remedies are so critical for brain health over time. And then we have a whole bunch of simple remedies that are beneficial as well.
And my next question was going to be about vitamin D. Most people don't think of vitamin D as related to this, but I know that if there are 2 things I know Dr. Wes Youngberg has a background and expertise in, and being an early adopter, or even literally writing the book on diabetes reversal years ago, and taking some heat for it, because you're not supposed to be able to say you can reverse that, and now everybody knows it. And like you mentioned, Ornish and others on heart disease, and you got Youngberg here. By the way, the QR code there, check out Dr. Youngberg's book. He's got the 2 books, one on the diabetes and one on the Alzheimer's, and those are related, as you're hearing here. But tell us about, I know you're a big specialist on the vitamin D front. Is that related to this conversation about cognitive health as well?
Yes, I've been doing this for almost 40 years now, and I've been through so many challenging, paradigms where the conventional wisdom was this is impossible and what you're talking about is quackery, and one of the early things was reversing diabetes, right? And I first learned about reversing diabetes. I didn't know anything about it, and I attended a lecture by one of the most eminent endocrinologists in the world, Dr. James Anderson, who's the chairman of endocrinology at the University of Kentucky at Lexington. And he, this is 1985, Scott, a lecture at Loma Linda University. I'd never heard anybody else say this from the university, but he said diabetes, type 2 diabetes is a reversible most of the time. I'm going like, what? I've never heard this before. Okay, but he demonstrated study after study after study that showed that. I go like, why haven't I heard this? I'm a student in a lifestyle medicine doctoral program, and nobody has ever even mentioned it to me. And so I became a student of Dr. James Anderson and followed his research and started promoting that myself. And of course, many people kept saying, Wes, you're not being scientific. There's not enough data on this. I go, now, no, you're not paying attention to the research that's already published in peer-reviewed studies. So that's been true for diabetes. That's been true for vitamin D. That's been true now for Alzheimer's. And there's always people that are critics about things that actually work because they didn't learn it when they were in school, so it can't be true, right? So bottom line on vitamin D, there was a study, Scott, that started in 1966. In other words, people who pay attention, doctors, clinicians who pay attention to the research should have known this a long, long time ago, even before I knew about it. Okay, so in 1966, a big study in Finland was started with 12,000 women who were about to give birth. And they started giving them 2,000 units of vitamin D, every single one. By the way, the standard of care right now in the United States is that the average person up until the age of 75 should only get about 600 units of vitamin D. And if you're over 75, you should get about 800 units of vitamin D. But that's the standard of care. Let me just say, for the record, that's a horrible standard of care. If you're willing to accept standard of care, you're accepting substandard. Well, I guess that's a oxymoron, but it's substandard care, right? So you need to demand optimal standards, not watered down standards that are usually considered the standard of care. So they started giving 2,000 units per pregnant woman. Okay, and then they kept recommending to the babies until they were older 2,000 units per day. And they did that study for 31 years. Now, why did Finland do this study? Because in Finland, that's the country that has the highest per capita prevalence of type 1 diabetes in the world. And this is what they discovered. In those individuals who took 2,000 units of vitamin D from being pregnant with their mom, right, when their mom was taking it, and then after birth, they took it 2,000 per day indefinitely, they had I think it was an 88%, an 88% decreased risk. It depending on the categories, anywhere between 80 and 90% decreased risk of developing type 1 diabetes. Now, what would happen if through one single intervention, we could eliminate even 80% of all type 1 diabetes? I said in an earlier podcast, Scott, that an 11-year-old girl who got COVID with only diarrhea as a symptom, and she developed within 1 week type 1 diabetes. This was in 2020. Okay, this is one of my patients who had, her mother had called me and was really scared. And so what's going on with my daughter? What can we do about her type 1 diabetes? If she had just been giving her daughter vitamin D, 2,000 units a day or more to optimize her level above 50 nanograms per ml in her blood, it would have been a very low likelihood that she would have ever gotten type 1 diabetes. Because vitamin D protects you from autoimmune activation of disease in a dramatic way. So in other words, it protects you against many forms of autoimmunity. That's one of the many benefits of vitamin D. And so that's why ever since 2020, 2000, the year 2000, so that's 24 years ago, I read in the paper that this Harvard doctor found that the amount of vitamin D in your blood had more to do with cancer prevention than whether you smoked or not. I was shocked. I'm an expert helping people stop smoking. I'm certified nationally and through the Seventh-day Adventist Church to help people stop smoking. And now I learned from this Harvard doctor that low vitamin D is even worse for you than smoking, statistically. Now, let me be clear here. I'm not saying as long as you take your vitamin D, you can smoke all you want. I am absolutely not saying that. I'm saying we should take advantage of every strategy that is reasonable. And that also means that most people are not taking advantage of the vitamin D supplementation strategy because they've been hearing from different agencies and a new endocrine society guideline that just published in July of 2024 that basically gave the impression to most doctors that we should never even screen for vitamin D again. That's not exactly what they said, but that's what the online medical journals were saying it said. Okay, and so it's basically vilifying doctors who order vitamin D as basically being part of the problem, costing too much money or charging insurance companies inappropriately, going against the standard of care. Okay, well, what I've learned recently, Scott, unless we're willing to go against the standard of care and rise above it, our patients are not going to really get that much better. Okay, so optimize your vitamin D, like you said, above 50 nanograms per deciliter as an initial goal, and take enough vitamin D to accomplish that by checking your vitamin D basically in the fall, like right around now, and again in the spring, and optimize your level so that you know what the right dose is for you on a daily basis. Don't take it once a week. Don't take a whole bunch once a month. Take a little bit every day. And by the way, my experience clinically in the last 24 years, where I've measured every single patient's vitamin D, is that the average patient that I work with, including myself, I'm a patient I work with, needs about 10,000 units a day. Now, I know that sounds a little high for many of you. Okay, certainly a lot higher than the agency standards. However, how are you going to know unless you test it for yourself? And don't rely on insurance companies to pay for that now, because what? The new standards are saying it doesn't need to be tested. And so, spend the $50, use a clinic that has discount options available where you can go to any lab like LabCorp or Quest and get a very inexpensive vitamin D test around $50. It could save your life by optimizing your vitamin D.
I was going to ask you, is there a shortcut for those who aren't going to get tested? Is there just a number that you recommend? But you really do think testing that vitamin D, not just for cognitive health, but you're mentioning immunity, cancer risk reduction. It's the single most important test that we can get done, isn't it? If you're going to skip any, that wouldn't be the one to skip. And you mentioned 50 whatever per deciliter. Is there an upper limit of where it's problematic? Do you just kind of aim 50 to 100? How do we know when we're optimized? It's like minimum of 50, but then where do you go from there?
Yeah. Okay. So of course the standards, the reference ranges for vitamin D on the lab itself will say 30 nanograms per ml up to 100. So those are the normal reference ranges. Now, those reference ranges are starting to change. Why? Because of the standard of care. So they keep changing the standard of care, even though the references really shouldn't change. So you don't need a level. There's no evidence that you need a level higher than 100. So if your blood level goes above 100, you should cut back on your vitamin D intake a little bit. Maybe take it one less day a week or something like that. Okay, but the problem is that most people are way inadequate. Okay, so the default position is that you're way too low and you need to do something. Okay, so I talked with Dr. Robert Heine, who's passed away in the last few years, but from old age. But he was the most prominent researcher on vitamin D in the world. He was a professor of medicine at Creighton University in Omaha, Nebraska. And I actually went up to him after a lecture about 10 years ago, or actually 15 years ago now. And me and this other family physician we're talking to him. So how much vitamin D should we recommend to our cancer patients? And he laughed at us. He says, well, how much cancer you want to prevent? And so kind of a funny answer to our question, but he's basically saying you optimize. And he says you're never going to be toxic on vitamin D until you give over 30,000 units a day for like many, many months, like 9 months or more. Okay. And I've never recommended that much for more than 5 days. Okay. So if somebody's low on vitamin D and they're sick, they need about 50,000 units a day for about 5 days to build up their level. But if they were smart and started taking 10,000 a day regularly for months before they got sick, now that they're sick, they just keep taking what they're taking, right? They don't need to boost that up dramatically because they already have that activated form of vitamin D in their body. So the studies on Alzheimer's, ironically, in 2006, I was looking at a journal article that had an editorial piece, an opinion piece, and this is a respected internal medicine journal, saying, it's really not helpful to check vitamin D anymore. They've been vilifying this from the very beginning, and really you shouldn't be giving patients vitamin D because we don't really know, whether it's helping them or not. It might actually be bad for them, they were saying. And so on that same month, in a different journal, it was the Journal of Alzheimer's Disease, they published an actual study, not an opinion piece, but a study showing that people who had low vitamin D had 125% greater risk of developing Alzheimer's disease. Now, I ask you, Scott, who are you going to trust? Some doctor who has an opinion, okay, that's probably doing the bidding of some other organization that has a vested interest in this issue, or a big research study that showed that taking vitamin D was associated with a lower risk of Alzheimer's. So it's very important in how we go about determining who do we believe in the medical literature, because there's a big problem in the medical literature right now. There's no question about that. Even the top editors in the top medical journals are saying that you really can't trust many of the studies that they themselves even publish. So that's a problem. So on the topic of cancer, though, Scott, just last week, I was listening to an interview with Dr. Angus Dalgleish, one of the most respected oncologists in the world, and especially in Europe, in the UK. And he said he's been doing research on cancer, what works for cancer, for 30 years now. And they were always perplexed by why some people responded really well to their cancer treatments and others did not. And it didn't seem to have to do with how old they were or other common variables that researchers look at. Until recently, Dr. Dalgleish, he said that we just discovered what it was, what the key determining factor was, whether you get benefit from what oncologists do. And you know what it was? I'll give you 20 guesses, Scott.
Vitamin D.
Yeah, it was vitamin D in the blood. And he said if you at least have a blood level of vitamin D above 40 nanograms per milliliter, and in Europe, they use micromoles per liter, which means you have to multiply by 2.5 to get the level. So in Europe, it's above 100. In the US and similar countries that use those units, it's above 40. So we need to get it at least above 40, and that almost always requires some level of supplementation. I would say 95% of the time, you're going to need to supplement. Now, let me say something. Some of your listeners might be thinking, man, what's Dr. Youngberg have against sunshine? You know, why don't we just go out and get some sunshine? Listen, I'm all in on sunshine. I am totally in on sunshine. I am big on getting vitamin D from midday sunshine. I am big on getting near infrared exposure early morning where you're not getting any vitamin D. But here's the thing. When I started checking vitamin D levels, I was walking on the beach on Guam in the middle of the Pacific in the afternoon wearing just a swimming suit for about an hour a day because I would lecture a lot at night. So I'd take a long lunch break and go and hang out at the beach for a little while and hang out at the pool, at the Marriott. You know, I mean, that was one of the benefits of living on Guam is we were right there. And so I thought, hey, I got all the vitamin D I could ever want, right? Well, I checked my vitamin D. Wrong. My vitamin D was only 24. Okay, so a couple key points. If you are using sunscreen, you're getting 0 vitamin D in that part of your skin. If you're older, if you're getting above 60, like me, especially if you're in the 70s and 80s, the likelihood of you generating enough vitamin D from sunshine is very, very little. Okay, and if you're on a statin medication, which many individuals are, you're basically blocking the production of vitamin D because of that statin. So, bottom line is, if you don't supplement vitamin D, you're probably not going to have an adequate amount of vitamin D to protect your immune system, to protect your brain, to protect your heart, etc.
Well, when somebody's told that they've been diagnosed with Alzheimer's, what is the typical framing of that? Because I have a feeling it's not what you're telling us today. Mainstream medicine doesn't seem to have solutions. What are people told when they get that diagnosis, or their families?
A friend of mine who's a geriatrician with a major medical center in California, and it's up north, but I won't name it. He called me up one day and he said, "Wes, man, I wish I could be doing what you're doing." I go, "What do you mean? You have access to all the same information." And he goes like, no, but you know, he was working partly for the VA and partly for a UC system, right? And he says, you know, I'm teaching residents, and this whole approach is just seen kind of outside of standard of care, and I need to be seen as promoting standard of care. And I go like, oh man, are you kidding me? And he goes like, no, I'm not kidding. He says, let me tell you the 3 most important words I teach my residents, okay, in the medical residency program at the hospital. When they diagnose Alzheimer's, you know what I tell them to say? I'm so sorry. And I go like, are you serious? Okay, because I would never say that. I would say, hey, listen, I get that this is a challenge for you, but let's figure it out. Let's figure out what your underlying causes are. Let's do a lot of tests here and start treating everything that is reasonable and prudent that from medical research that is related to this risk. There are dozens and dozens and dozens of risk factors that have been well established in the medical literature, and we're not going to give up on you until we've addressed every single one, left no stone unturned, and done the blood test so that we can put you on the mending track. At minimum, Scott, what I tell them is there's three things. I have three goals for you. Number one is we want to slow down the progression of this disease. Now, many of the people, by the time they set up a Zoom appointment to see me, they're already going like, hey, I want to reverse this, right? Okay, but I tell them the number one goal is to slow it down. They go like, oh, I don't want to slow it down, I want to reverse it. He says, well, you can't reverse something you don't slow down. If you're going 90 miles an hour, getting ready to go over a cliff, you got to put the brake on first. Okay, then you got to slow it down, you got to stop, and then you got to reverse it, right? So I tell them you got to slow it down. And we believe we can do that 100% of the time. Why is that important? Because most people, once they learn about their problem, it crescendos. It snowballs. It gets worse and worse, and it gets rapidly worse. And so we can slow that process down. We can dramatically improve the quality of their years. So that's number one goal. Number two goal is to stop the progression. And that means we got to be even more aggressive on the strategies that slow it down. Okay, and keep looking for as many of the underlying causative factors such that we get to that tipping point, Scott, that point where we're actually making a difference and actually healing rather than promoting the illness. And then the third step, of course, is to reverse the condition wherever we can. A prominent neurologist came up to me at a conference. We were both speaking at this international conference. He says, Wes, you're not telling people you can reverse Alzheimer's, are you? And I said, well, define Alzheimer's. He he stood back for a second like he was baffled by the question. I mean, I said, hey, you're the neurologist, define Alzheimer's, right? And so if you define Alzheimer's by going back to where you were 30 years ago, then no, we're not going to reverse it that way. But if you define Alzheimer's as a dysfunction where you're no longer functional, you're gradually losing function in your everyday lifestyle. We can begin to reverse that. No question. I see it all the time. Okay. Now it takes work. It's not easy. The spouse has to be 100% in on it, because if they're not, it's not going to work usually. And family members need to be 100% in on it too. That's why I encourage them to join the Zoom sessions with me and we record them so that they can actually watch it and understand what's really important here, because there's so many things that are so critical in this process. So that's how we go about doing this.
You're talking about actions you can take that you're actually empowered in this journey of cognitive health. And I think a lot of people are under the impression, well, it's just your genetics. And, so I want to ask you first, tell me, how likely is somebody to eventually be diagnosed with Alzheimer's or other forms of dementia? And then also, is it just genetics? How do you respond to that where we are disempowered?
First of all, everything is genetic. It wouldn't happen if the genes didn't allow it to happen. Okay, so now don't misunderstand me. I'm a big fan of genetic testing. I strongly recommend genetic saliva testing because from that we can develop genetic documents that are like 50 pages long that tell us what the little SNPs, the single nucleotide polymorphisms, are that drive risk. And by knowing where those mutations are, we know exactly what to do to neutralize or minimize the outcome of that genetic mutation. So when you have a genetic mutation, which we all have lots of them, by the way, I got tons of mutations. I know, I see them every day because I show them to my patients, right? Okay, in other words, don't be scared of your mutations, Okay, don't no longer allow yourself to be a victim of your genetic mutations. Be a master of your genetics. Be in control of your genetics. We can change the outcome. We can't change the fact that you have the mutation, but we can change the downstream effect of that mutation by knowing where it is. That's the beauty of genetics. Never let some doctor or professor tell you that genetics are unmodifiable risk factors. They're dramatically modifiable at the outcome level. Okay, so that's the first thing about genetics.
How likely is one to get Alzheimer's? Dr. Youngberg, I'm going to have you start that one over because our great technician Jeremy missed the beat there. So we'll go ahead and mute me so you don't hear my echo, and then give us the data on that.
It was just done on purpose so that we could highlight the importance of this statement. Thanks, Jeremy. No, by the age of 85, it's a 50% likelihood that you will have Alzheimer's, and that was historic. We're now seeing, because of COVID, okay, because of all the spike protein pathologies that we're seeing, there's a dramatic increase in Alzheimer's worldwide, dramatic. So it's going to be much higher than 50%. And so we need to protect our brain. We need to take advantage of all the natural remedies and to prevent viral infestation of the brain and spike protein infestation of the brain. That's really, really critical.
Well, I want to get to your solutions. I love in your book, by the way. I hope that QR code comes up as I'm posing this question, because that book, Memory Makeover, excellent content that you, our listeners, are privy to some insights and some teasers on in this interview, and then go deeper and share that book with somebody who's facing this type of diagnosis, or you're wondering, boy, so and so, they seem like they're not quite as sharp as they were before. I think these conversations are so common in families, and to be armed with resources on that, I think, is hugely beneficial. So I do encourage folks to check out Dr. Youngberg's book. But one phrase that stands out is kind of a framing of this as two different approaches: consensus-based mediocrity versus cutting-edge protocols. And they face off one against the other. What does that mean? The mediocrity, the cutting-edge protocols, consensus over here versus maybe things that actually work. Give us the data dump on that and how we can actually take action, even if we're finding ourselves with the diagnosis, not to mention the rest of us, things we should be doing. As you've already mentioned, vitamin D, you mentioned the same things you're dealing with diabetes, you're going to be dealing with Alzheimer's reversal. But give us more on how this consensus needs to be challenged with some cutting edge protocols.
A quick case in point: would you put something that you believe with all your heart, based on your research, based on your understanding, whether it's a theological question or a philosophical question, okay, would you submit your belief to a popular vote?
No.
None of us would do that. That would be ridiculous, because popular votes are almost always watered down, if not absolutely wrong. Okay, so if you look at any truth, whether it's in the realm of philosophy, religion, or science, okay, if you look at the popular vote, chances are it's not going to be a high standard. It's going to be a mediocre standard. So you're getting some benefit, but you're also missing out on the benefit that you could do, which means you're actually doing some harm. So I learned this early on in my clinical career. I would be looking at some research. Like, for instance, Harvard did this amazing study on inflammation on a blood test called cardiac CRP, or high sensitivity C-reactive protein. And the health professional follow-up study at Harvard was brilliant, under the direction of Dr. Walter Willett, MD, PhD, epidemiologist, who knew that the popular opinion was almost always wrong. So he didn't like to be part of consensus conferences because he would say, oh, you've already decided what we want to vote, what we want to vote on. Almost any committee that brings a consensus question to you, the head of the committee has already been manipulating the decision so that you would vote their direction. I mean, I've been on lots of committees. I know how this works, right? And so be very wary of consensus documents, of white papers, of medical decisions or any other decision that's based on a consensus, because that by definition is mediocrity, by definition, right? So the health professional follow-up study, they wisely banked a lot of blood from participants from the very beginning of the study. So they could go 30 years into a study, a new test comes available that's revolutionary, and they can go back into their blood banks and measure a sample of blood from 30 years ago and compare what to new samples 30 years later in the same patient, and they can track their diet and their lifestyle during that period of time, and they can show clearly over time what risk factors, what health behaviors drove inflammation in the body. Okay, and so when that came available, Harvard did a really good job at showing different levels of risk with the cardiac Sierra blood test. But then the committees got a hold of this. National committees got a hold of this, and they came up with a consensus paper that totally watered it down. And I knew right then and there, I'm not going to go by the new consensus study. I'm going to go by the experts that did the original study, and which is much more clinically relevant than some consensus. So be really careful with consensus here, because the consensus in Alzheimer's management is that there's nothing you can do. I'm so sorry. We have some medicines for you. By the way, we know the medicines don't really work, but they might help you feel better temporarily. So that's what we're going to prescribe. That's literally the standard of care right now in Alzheimer's. Okay, and of course, what we're trying to do is we're trying to change that standard of care. And Dr. Del Bredesen and others like him are doing a very good job of raising the public awareness. And here's the key. The public awareness should be driven by the agencies responsible for public health. But the problem is, as Dr. Redfield and others have shown, is that these agencies are captured by corporate America. They have very different motivation than just doing what's right for public health. Their motivation is to do what corporate America wants, right? Going back to vitamin D real quick, Dr. John Campbell, an amazing professor who's been focusing on COVID for many years now from the beginning. He's always been promoting vitamin D. For the entire time of his video series, he had a little dog with a sign on its neck sitting on his on a little fake dog that with a little sign on its neck said, "Take vitamin D." and so he said, what would happen if everybody in the world started taking vitamin D the way we're recommending, the way Dr. Dalgleish is recommending for cancer prevention, the way Dr. McCullough is recommending for the immune system, etc. It would dramatically cut into the profits of Big Pharma, unfortunately, right? And of course, Big Pharma is more interested in their profits because their bottom line is paying attention to the shareholders. They have no other responsibilities, apparently. And what I would suggest is that we all need to refocus on what's best for the patient, regardless of what's best for us. Okay? I try really hard every day to stop thinking about what's best for me and focus on my answer should be what's best for my patient. And if everybody did that, there would be a dramatic transformation in the standard of care around the world.
It's so sad that even needs to be said. Isn't that the whole purpose of the medical profession? And when you mention pharma and regulatory capture, where the regulatory agency of the federal government that is tasked with regulating the industry ends up with the industry owning that regulatory agency. It's called regulatory capture. This was a vocabulary term in the AP government textbook that I taught out of for years. And I remember when COVID hit, and so people were skeptical about, hey, maybe we shouldn't just necessarily listen to what Pfizer tells us about their own product, not to mention the public health agencies that seem to have, they're kind of in bed together here. This is not necessarily an unbiased watchdog agency, and because of a revolving door where you go from the agency to work in the industry, and then once you've been at the agency, being kind of friendly to the industry, then you have a cushy job over here in the industry because of how you treated the industry from the regulatory standpoint. That's another vocabulary term in the AP government textbook, the revolving door. And then when COVID happened and skeptics were like, hey, maybe we should think twice. Maybe we need some oversight here. People were like, you conspiracy theorists, right? And it's like, no, that's not a conspiracy theory. That's human nature, what you're describing. And I hope every caring person will do what you just suggested, care about the patient. Now, by the way, hello, we got some shout outs coming in. Birds, bees, and trees, thanks for being here. I want to ask Dr. Youngberg, welcome, Sonia. She says, come on, cognitive health. Yes. And I think listening to this conversation is improving our cognitive health, isn't it? Andrea from the UK, welcome. Um, I want to get you primed, Dr. Youngberg, while I say hi to these folks for talking about lab tests that you use to determine people's cognitive health status and how there may be risks for cognitive decline. Jeannie from Malaysia, welcome. I know we've got people from all over the world. This is a big broadcast, Dr. Youngberg. I hope that you get a lot of people coming for help on this front and others. The diabetes, the lifestyle medicine. Dr. Youngberg is lifestyle medicine across the board. Amanda says she's learning here to learn and digest knowledge. Welcome. Good afternoon. So she must not be where we are here. Maybe on the West Coast. Dr. Youngberg's still in the afternoon out there in California. Space Girl says, blessings, saints, and blessings to you also, Space Girl, watching from Iraq. I can't pronounce the Arabic there, but welcome. Jeannie from Malaysia, good morning. And we're so happy to have an international audience. Oh, we've already got some questions. Can we take some questions now? I know we want to talk about lab testing. We want to talk about those things. I have several questions that I've typed out that I want to go through. But how about throw this one in there right there from Mish? Is aluminum a risk factor? I think I know what you're going to say to this because I think the questioner is on to it. What do you have to say about aluminum, Dr. Youngberg?
It used to be that the general answer to that question was we don't know enough information about that. But the world's leading experts on aluminum research relative to neurologic health have over the last 3 to 4 years been saying there's no question that there is a causal relationship between the amount of aluminum that builds up in the body and how that affects neurologic function. So the bottom line here is that we want to have a lifestyle that helps get rid of aluminum that's already in our bodies. There's a lot of different sources of aluminum, so avoid cooking in aluminum cookware. Avoid using any aluminum foil in any form touching or near your food, especially in heating food. Okay, that's really bad. I used to go to camp. Christian summer camps, and they would cook potatoes in a fire outdoors, with aluminum foil on it, or corn with aluminum foil on it. What's going to happen? That aluminum in the aluminum foil is going to leak into that food in a dramatic way because of the heat. That's really, really bad for the body. Aluminum going into the body is bad no matter what form it comes in. And so we need to limit our exposure for it. Absolutely.
Well, I want to follow up on that. Product that I think people get about 70 doses of during their childhood, and we shouldn't name on these platforms because we might have some problems with shadow banning and strikes or whatever. But I think you're aware of what I'm referring to. They used to have mercury in them with an ingredient called thimerosal, and my understanding is that that was phased out because of controversy, and then an adjuvant that contains aluminum was added to them. Is that a concern at all from your perspective?
Of course, I said already, anything that adds aluminum to your body, and of course, especially if you're injecting it directly into the body, that's even worse, right? But we just need to be cognizant of aluminum exposure. And I even measure patients' aluminum levels as well as other heavy metals. As you don't expect your insurance company to pay for that, by the way. That's something that you should be willing to get a discount rate on through. You can get any lab you want through Quest or through LabCorp by just using the right services. So you can get any lab you want. You pay for it yourself. Any lab. Okay, so don't wait to have something paid for by your insurance company, because chances are when we're looking at above the standard of care, they're not necessarily going to be covered. So there's all kinds of other labs we could talk about if you wish.
We'll get into that lab question. I want to, as far as there's questions, as long as there's questions popping up on the screen, we'll take those in turn, and then we will make sure to get to those lab topics because those are very important as the flow of understanding the process of how you actually help people with Alzheimer's. But yeah, chime in.
Because they're kind of going through real quick. Is somebody's asking, what if I just get a vitamin D injection once in a while? Is that okay compared to a daily dose? I would say no, it's not okay. Now, that's better than not getting any at all, right? At least you're getting it. Okay, but there's actually many studies out there that raise questions and concerns about the bolus doses, especially if you're injecting it, because it's not really a natural way to get vitamin D. And that's forcing your body to have to convert a lot of vitamin D all at once. It's put more pressure on your liver and your kidneys. And so the healthy way to do this is take a little bit every day. It doesn't have to be every day, okay, but a little bit most days of the week. And that's by far the best way to do it, because if you're sick and you're like, oh man, I haven't been doing any vitamin D, I haven't been paying attention to this, and now I'm starting to get sick, then you better start bolusing that about 50,000 units a day for 3 to 5 days, because it's going to take about a week for that vitamin D to convert to an active form where it can protect you. But it's going to take about a week to 10 days before that illness can actually take your life as well, usually. So at least start on the first day of exposure or the first day of the symptoms of the infection. Okay, but the smart person, the wise person, is going to be doing a little bit every day.
Excellent. And on the cognitive health, there was, hi, by the way, Ramo from Rialto, not that far from Temecula, right? Temecula is where the Youngberg Lifestyle Medicine Clinic is. And he does Zoom appointments, obviously. And hello to Cheryl from Southern California. Very sad. Your dad died from Alzheimer's. She wants to know how to stop it. So answer that. And also answer the one from 2 questions ago that I never got to about diet and cognitive health. I have a feeling that is a huge part of this picture in this program, huh?
Yeah, well, one of the reasons, Scott, that I'm doing the full program myself. I'm not just letting my patients benefit from this. I'm doing it myself. Why? My grandfather died with Alzheimer's. My mother died with glioblastoma at age 39, so she could have had problems with it. Her younger brother has Alzheimer's right now, and I'm helping him with that. And so I know I'm at risk. I know it. And so I'm doing everything I can right now. The key is that we just need to get focused on doing, jumping through the hoops, figuring out what we need to do. I discovered many of the things that I needed to do. I did an omega-3 blood test, and I discovered I had a very low EPA-DHA blood level. Okay, and that's dramatically linked to future risk of developing dementia. So you check that, you optimize it, and you recheck it to make sure that you're making progress. And then you can say, hey, check, I'm doing what I need to do on that, and then keep doing that. Okay, so we already talked about vitamin D. Optimize your vitamin D. Optimize your zinc I always look at the copper zinc ceruloplasmin blood levels. There's literally 100 different individual labs that I look at that we if they're at all not optimal. I'm not just looking at are they really, really bad. I'm looking at are they not optimal. If they're not optimal, we tweak that so that they become optimal. And the more we do that to different tests, the more likely we are to get to that tipping point once again. That means our body's starting to heal rather than progress in decline.
Absolutely. And that omega-3 DHA EPA, I believe you're wanting like 1,000 milligrams of that per day, right?
Grams of the DHA specifically, in addition to the EPA. Okay, so we got to be real specific about that, especially if there's risk. So, if you have a family history of Alzheimer's like I do, okay, then we need to start by age 40, if not before, in addressing the risk factors now, so that we have a long track record of controlling the risk factors so that we don't have to, hit the ground running later on to try to reverse them.
Absolutely. And you mentioned some of the labs that you do. I want you to feel free to pick up more of the conversation on the lab test, because that seems to be a huge, like the critical issue here. And you also mentioned earlier, very early on in the program, it was about rest and sunlight and being outdoors and just kind of all the laws of health, if you will. But then what are some of the triggers for cognitive decline? Where, the previous question, and we do want to say hi to Dolores. So Jeremy, keep that up there. But I'm still remembering the question from a few moments ago. What foods to avoid in order to protect our cognitive health?
So once again, the trifecta, 3 key things that are most critical fundamentally to brain health is diet, exercise, and sleep. And of course, there's many others as well that you could add to that, but you got to make sure that you fix all 3 of those as well as you can, because each of those can be deal breakers. So one of my colleagues who is an expert in preventive care, recently he says that the most important thing is exercise, especially in old age. Now, he's right in a way that if you exercise and you strengthen your muscles during your senior years, you're going to be more functional, and that's critical for brain health. Exercising all by itself increases the production of what's called BDNF, or brain-derived neurotrophic factor. You produce more of that if you exercise. And a lot of us have mutations that prevent the full amount of that being produced. So if we exercise more consistently, we produce more of it. Okay, but here's the key. If you exercise thinking that, hey, I'm going to take care of this and that's more important than nutrition, you'll be wrong. None of the fundamentals are as important as nutrition. Why? Because what you eat that gives you the substrate from which the body is built. And if you eat unhealthy foods, you're going to be built in an unhealthy way. Let me give you an example of that. Once somebody already has some level of cognitive decline, let's say they have a moderate form of Alzheimer's. They have been diagnosed with Alzheimer's. They can still communicate fairly well, but man, their memory is really bad, and they're struggling with that. I've had patients tell me, their spouses tell me, my husband ate one unhealthy meal at a grandson's birthday party. It set him back for a whole week. He dropped 75% in his cognitive status function the first 2 to 3 days, and then gradually came back. But it took him a week to get back to where he had risen through the program. Okay, so now most of us go, that can't happen. If we'll go to a birthday party and we'll have birthday cake and ice cream and whatever else they have on there that's probably not really healthy food. And, we don't feel any worse for the wear. But that's because we still have cognitive reserve. But once you get to the point where you're starting to lose cognitive function, you've already lost a huge percentage of that cognitive reserve. I'm talking about a huge percentage. And I have all kinds of lectures that are on different websites or different YouTube channels that talk about this. I recently did a talk in Ukaipa. I don't know if you can post that as well. I was talking about how do you optimize hippocampal neurogenesis, to the growth of new nerves in the memory section of the brain. Okay, you can lose 1,000 nerve cells in your brain, neurons in your brain, in the hippocampi every day. Or you can stop doing that and actually start adding another 700 so you can regain that function. Okay, so the average person never regains because they're not doing what is necessary to regain. They're not even doing what's necessary to stop losing 1,000 nerve cells a day. Okay, so once we've reached that point where we're at mild cognitive impairment, or we're at early Alzheimer's, or we've done some of these new tests that are available now for the first time in the last few months that actually measures neurodegeneration, that measures neuroinflammation, that measures beta amyloid and tau protein deposition in the brain. Okay, now we can actually measure a problem even before we have the symptoms. And if you have that, we better get focused on addressing the risk factors. And fortunately, we know a lot about what the risk factors are. We just have to be vigilant enough to test them, work with somebody that believes it can be done, number one, right? And then make sure that we're intervening upon them.
Absolutely. I'm glad you got a mention of some of those lab tests in there, because folks, this is actually a medical practice that folks can go to, and they can get these tests run. They can have the Zoom meetings. They can learn. And by the way, if you want the 7 hours that he just mentioned that he recently did, and we were asking, Jeremy was asking, can we link to your YouTube, where people can watch your stuff. And he's so focused on his practice, he's not really doing a YouTube. So send me an email. I'll send you a link to where those are posted, where he did that series at that church on cognitive health for 7 hours. You will have more than you need. There is the YouTube channel. You won't find it there, but send me an email and I'll send you the link. scottritzema@gmail.com. And there's the spelling of my name, Ritsema. The previous person, Dolores, had a question up there about type 2 diabetes. And I want to, there's the QR code for signing up with his coaching sessions and being able to be a patient of the Youngberg Lifestyle Medicine Clinic. She was saying, I want to get rid of the unhealthy food on my table, basically. And so there it is. What are the most harmful foods? Not just for type 2 diabetes, but for cognitive health.
So what's the question?
She says, I want to stop using these harmful tables. I think it means the harmful food on the table, and give some guidance about what's harmful for diabetes.
Okay, so there's a lot of information. By the way, in my book, Memory Makeover, there's on pages 83 and 84, there's a whole list of all the labs. It's not all the labs that I do, but it's a lot of them. Also in the diabetes, Goodbye Diabetes book, there's a list of labs there as well. Okay, but in the diabetes book, in particular, there's a whole multiple chapters on the diet itself. So there's a lot, we could spend hours talking about the diet. I also have on my website access to what's called Diabetes Undone program. This is a 40 video program that's all available online, okay, with a workbook and a cookbook that you can get the entire thing for $99 from you can order it directly from my store, dryoungberg.com. But the reason I'm mentioning that is because that has over 10 videos specifically on dietary strategies that could guide you. So there's a lot to it, but let me give you some pointers right now. First of all, it's whole plant-based foods. So whole food, plant-based strategies. Those are the foods that have the nutrients in them that help heal the brain. and help neutralize, because nutrients neutralize toxins. So we're all exposed to toxins every day. If we're not eating a diet that's high in nutrients, we're not going to neutralize those toxins very easily. Okay, so that's the first step, is a really healthy diet that's loaded with healthy non-starchy vegetables, healthy starchy vegetables, healthy whole grain products, and healthy whole food fat products as well. I don't promote a low-fat diet, by the way. I don't. Okay, I like avocados, I like nuts and seeds. I recommend moderation in fat, but a lot of people need a lot more fat than they're getting, strangely enough. But many people need to cut back the type of fat they consume. It's the type of fats, the type of carbs, the type of proteins that they're eating that's the problem. So if we're shifting towards a plant-based program, that's key. You know, we talk about disinformation and misinformation and malinformation. There's probably no more of that than in the area of nutrition. Okay, there's all kinds of diets that people promote. So, man, I lost my weight because I did carnivore, I did paleo, I did whatever. Okay, here's the bottom line. Now, there's actually truth in those programs, but not 100% truth. Okay, there's truth on there. They're basically, the truth in it is that they're getting you to stop eating all the junk food. That's all the refined carbohydrates and sugars that you've been eating. That's the number one problem. So all those paleo diets and the carnivore diets, etc., they do that well. They get rid of all that junk food, most of the junk food that people consume. Okay, but they're still incorporating some foods that are really bad for the health, in my opinion. Okay, based on the studies. Okay, so the key, what it comes down to, what's the best approach? Okay, and the best approach starts with, you gotta limit unnecessary carbohydrates. You got to. And I take a lot of heat from this, even from my vegan colleagues. You know, they say, no, as long as it's vegan, it's good for you. No, that's not true. That's absolutely true, not true. And that's why the promoters of the paleo diets and the ketogenic diets, they get away with what they do because of individuals that wrongfully promote a 100% vegan diet and say, as long as it's vegan, it's good for you. Well, Diet Pepsi's vegan, you know, soda's vegan, you know, cocaine's vegan, you know, heroin's vegan, you know, so that doesn't mean it's good for you. So you got to eat healthy. You got to think, what is healthy for me? And so we got to focus on lots of non-starchy vegetables. Now, if you have type 2 diabetes, by definition, that means your blood sugars are too high. And if your blood sugars are too high, that by definition, that means that you're getting more carbohydrates than you need. Now, that doesn't mean that whole plant-based carbohydrates are bad for you. That just means you got to get rid of all the bad carbohydrates. That's the first thing you got to do. Okay, and then we need to optimize health in every other way. Okay, so I actually make a lot of enemies when I lecture on nutrition because I don't make anybody happy. Okay, because I'm all about truth, about what works and what's most important. And now I promote a whole plant based diet, and basically I promote 100% plant based is the best way to go. Okay, but we know from individuals that have our best interest at heart that if you got to choose between eating, you know, a lot of refined carbohydrates or eating some quote healthy range-fed meat, you're actually better off doing the meat. Now, I think you're better off not doing either, right? And that's what I promote. But I'm just trying to be honest about how bad refined carbohydrates are for people with type 2 diabetes. Okay? That's why you can go on a paleo diet and reverse your diabetes pretty easily. The problem is you'll damage your kidneys more than likely if you do that. How do I know that? Because I work with patients all the time who have gone on basically a very low carb diet that promotes more meat, and that literally destroyed their kidneys. Their glomerular filtration rate, which is a measure of how well the kidneys are able to filter out toxins, dropped all the way down to 25% of its potential. That's really bad. That's really bad. Okay, so, but we were able to regain that kidney function by going back on a 100% plant-based diet that, yes, promoted a healthy protein, but not an animal protein. Okay, so now somebody who's not ready to go 100% plant-based, okay, what we do is we limit the animal-based proteins in the diet and choose from the healthiest options. Okay, that may not be the best option, but that's a lot better than what most people do. Okay, so there's a lot to the diet, and my goal is not getting people to do exactly as I do, but helping people move in the direction that's right for them. And the more motivated they are, the more aggressive we can become in doing the best thing, and that's what's going to give you the best potential to reverse your diabetes if you go all in.
Excellent summary of the dietary controversies. And I'm in harmony with that. I know Living Springs is in harmony with that idea of whole plant foods, but not a bunch of refined junk food. And I love your take on the word vegan. I don't like that word because it tells you nothing about what you are eating. It only says what you are not eating. So you can be eating Oreos and French fries and soda, like you mentioned, and that is vegan, but that's junk food. So the word doesn't tell you anything about what you are eating. So whole plant foods is the answer to the question that Dolores is asking about. So excellent. And Jeremy, we can take more questions. Are you up for a few more questions, Dr. Youngberg? Marissa says, good morning. Thanks for emphasizing the natural remedies and lifestyle are crucial to maintaining our health, including our brain cells. God bless you and your company. Thank you. And oh yeah, chia seeds. Those are a good, nutritious food. We got the thumbs up from Dr. Youngberg on the chia seeds. And he was mentioning omega-3 fatty acids. The DHA and the EPA aren't coming directly from the chia seeds and the flax seeds and the walnuts, right? So I take algae omega. It's a supplement because we don't eat a lot of sea vegetables, which is where the fish get their omega-3 fatty acids from, right? So if you're not eating the fish, you want to be taking one of those, and then you're getting your ALA fats from your flax seeds and walnuts and stuff like that, as well as your DHA and EPA from the supplement. Geraldine says hi from Ohio, and Wendy, what should you take with the vitamin D, Dr. Youngberg, to make sure you're getting the vitamin D and absorbing it properly?
Yes, there's a couple of things that you want to make sure you're doing. Now, first of all, just make sure you get your vitamin D. Okay, that's some people say, well, I don't know what I need and what I'm doing, so I'm not going to do it. No, take your vitamin D. And then on top of that, the number one, take some vitamin K2 MK7. That's a form of vitamin K that actually is produced by bacteria. And so that we're typically low in that. If we're eating the way we're supposed to, with lots of green leafy vegetables, we're getting a lot of vitamin K1, but we're not getting vitamin K2 from our vegetables. So that's actually a good one to supplement. I supplement vitamin K2 on a regular basis. That should be at least 100 micrograms a day. I actually take just over 300 micrograms a day. I like vitamin D capsules that actually come for every 5,000 units of vitamin D3. They give you 180 micrograms of vitamin K2 MK7. That's the way I like to balance it out. And I do 2 of those a day myself. But how are you going to know what you should take? By testing yourself. Now, you can't test vitamin K2. I'm not aware of any tests for that at the moment. Okay, you just need to supplement it. The third thing you need to supplement is magnesium. Almost 80% of the population is deficient in magnesium. And if you're diabetic, it's a 100% chance you're deficient in magnesium. Or if you have high blood pressure or heart disease, magnesium is really critical for so many things. And so I take 100 to 200 milligrams of healthy magnesium once or twice a day usually. And so you don't have to take it at the same time as vitamin D because magnesium is water soluble, but vitamin D is fat soluble. So just sometime in the day, replete your magnesium levels. And that helps your body convert vitamin D appropriately to their active forms. And then last of all, it's probably a good idea to have a little bit of vitamin A. Vitamin A, especially if somebody's not eating real healthfully, they're not getting a lot of beta carotene from carrots or orangish vegetables, and therefore you got to make sure that you have enough vitamin A. So the typical rule for vitamin A is balance your vitamin A, take about the same amount of A as you do D. So if you're taking like 5,000 units of vitamin D, take about 5,000 of vitamin A. But you can get vitamin A through beta carotene through other sources, through your diet, whereas you really don't get vitamin D through your diet at all unless you eat lots of mushrooms. Okay, and most people aren't going to do that. Okay, or unless you eat fish, and I don't recommend that because fish, by definition, or by experience and exposure, is going to have a lot of toxins, is going to have potential viruses and parasites. So that's why I don't eat fish. I know Jesus ate fish, but I think if Jesus were in this world today, he probably wouldn't eat fish, mostly because there's just too many toxins. Let's just face it. I probably would eat fish if I knew it was really clean, but I don't think there is such a thing anymore as clean fish.
Yeah, no doubt about that. Acuna says, I have chronic anxiety. Any remedy for that? The magnesium will help with that, right? But what else?
Yes. Magnesium is very important. There's all kinds of studies showing that magnesium is beneficial for anxiety. One form of magnesium in particular that I use with my patients is magnesium L-threonate, because the magnesium is bound to the amino acid threonate that allows that magnesium to cross the blood-brain barrier more effectively and therefore help with neurologic health. So therefore it's good for brain health, Alzheimer's risk, but it's also good for anxiety because of that. There's one of the key things for anxiety, by the way, speaking of blood tests for Alzheimer's, one of the first and most important blood tests I recommend for Alzheimer's, and this is true for those with anxiety, is a 4-hour glucose tolerance test. Now, it's a kind of a complicated test because we're also measuring insulin and cortisol at the same time. That is discussed in detail in my book, Memory Makeover, in chapters 5 and 6, where I go over how to do that test properly. Remember, don't expect your doctor to order that test. Most doctors don't know anything about that test because it's not a typical test that doctors order. And if they don't know about it, they really shouldn't order it because then they'll be responsible for a test they don't know how to interpret. Okay, so it's understandable why they don't order them. Okay, but you can order it yourself through certain lab options online, and I order that test for every single patient that I work with, and that tells us whether your blood sugars go too high and then too low. And what happens is that many people have a tendency for blood sugars to drop too low. They are insulin resistant. Their blood sugars initially are too high, but then they drop. This happens in prediabetes, before prediabetes, and even in diabetes as well. And that dropping blood sugar stimulates the production of cortisol, which can make you feel more anxious. And it can also create insomnia or waking you up early in the morning. Now you can't sleep anymore. Of course, that's going to make you more anxious because you're not getting your rest. Okay, so whether somebody has insomnia or anxiety or whatever the reason they come, I usually order that test, and that gives us a lot of clues of what to do. So sometimes balancing your blood sugars really effectively during the day and night can dramatically calm anxiety. So that's one strategy that I recommend. But the omega-3 fatty acids, the EPA DHA that we mentioned, is another way to lower anxiety as well. But there's many strategies, and we've just touched a couple of them so far.
I would add not necessarily diagnosing anxiety disorder, which is not my field, but I teach on media and the effects of media, and they tend to overstimulate and cause stress. And in every study on that topic, the antidote for overstimulating media, which causes more anxiety, is nature exposure, green environments, getting outdoors, fresh air, exercise, and literally just the beauty and peace of nature does help, in addition to the nutritional benefits that Dr. Youngberg, yeah, he's got his device right there.
Put the phone away, turn off the computer, get outside and enjoy the trees, the greenery, the woods, the forests, go hiking. That is an amazing antidote for a lot of things, including anxiety.
Love it.
Love it.
Welcome, Marnoon from Whidbey Island. Glad you're with us tonight, or whatever time of day it is for you. Ali Karoma says, hello, hello, hello. Thank you very much. I'm so happy to be here. I'm writing from St. Lucia, West Indies. Welcome, Ali, from the islands. And Jeannie, thank you very much for your sharing. Dr. Wes Youngberg, you are very much appreciated by this audience. I know that. This has been a highly profitable hour and a half. How time flies. We really appreciate the time you've given to us, Dr. Youngberg. We'll get a couple more comments and hellos here before we wrap up. But Mary from San Antonio, Texas, love all the info coming through. Glad you're enjoying it, Mary. You're part of the LSR community. We appreciate each and every one of you. Cindy, lifting. Okay, so Space Girl is saying that she's praying for Cindy, who's lost her father to Alzheimer's. So thank you for that prayer, Space Girl. We appreciate that. Claudia says, how do you know your daily dose for vitamin D? Dr. Youngberg mentioned he takes 10,000 and a lot of his patients need that amount. But I think you already answered the question. How do you know is by testing, right?
Yes, and in addition to that, so I tested my vitamin D in the year 2000 when I first learned the relationship between vitamin D and cancer. And little did I know that it not only has a huge relationship to cancer prevention and management, by the way. If you get diagnosed with cancer, the first thing you should do is optimize your vitamin D, because that's going to improve everything else you do is going to work better if your vitamin D is up. Okay, but it also protects your brain, it protects your heart, it protects your immune system from everything, right? So vitamin D is critical. Okay, so when I checked my vitamin D the first time, it was really low, 24. So I started taking 5,000 units a day. I took that for a time. It's going to take about 4 or 5 months before that gets to a new set point. Okay, so that's why we say we check in the fall, like right about now, and then we optimize the vitamin D. Take at least, if you're low, if your level is low, you're going to need at least 5,000 units a day, in my experience. And you do that, take that for 3 to 4 months and recheck. Okay, and if at that point your vitamin D is starting to get close to 100, then you know that you might need a little bit less than 5,000. But in my experience, very few people need less than 5,000. Okay, so if you're not sure and you're not really buying into what I'm saying, good for you. You know, I want you to be critical. I want you to think for yourself. Don't just do stuff because I say it. Look it up, but don't look it up on a fact-checking website, because they're just going to be regurgitating what somebody wants them to say rather than what the truth is, right? So you look at the actual research, and as you look at the research, the common variable is that you're going to need somewhere between 5 and 10,000. Okay, so when I used to run a gestational diabetes clinic every Wednesday morning for about 7 years at a large medical group, and there's 2 things I did for those women. And besides optimizing their diet and their daily exercise and doing light exercise immediately after meals to lower their after meal blood sugar, I made sure that they all check their omega-3s and their vitamin D. And then I optimized those. So every woman who's pregnant, I had them take at least 1,000 milligrams of DHA, if not more. Okay. And every woman who was pregnant, I had them do 10,000 units of vitamin D. Now you might think, oh, whoa, wait a minute. You're doing that much for pregnant women? Aren't you concerned that might be a teratogenic risk to the baby? No, I'm not. You know why? Because I read the research. And all the research, the OB research, was saying that's what we should be giving women. And so that's what I did. And you know what? A low vitamin D level during pregnancy dramatically increases the risk of that baby becoming schizophrenic later on or having a mental illness later on in life. If we just did these basic things that we're talking about right now and everybody did it, it would revolutionize the health of the population. And so we just need to take advantage of this, and then make sure that we're appropriately adjusting the dose of everything we do according to follow-up testing.
Raymond asks, where do you get the minerals that are found only in meats?
So yeah, I read your question, and I'm proud of you, Raymond, that you're making a decision about your health, and you're eating a diet that is devoid of the worst foods ever, and that's the refined sugars and the refined carbohydrates and the junk foods. Okay, good for you. That's a really important step. But do not think that minerals are only in meat. Guess where the cows got those minerals that are in their flesh? From eating vegetables and eating grains. That's where they got it, right? So you're just getting secondhand minerals in that respect. Now, yes, there's vitamin A, there's fat soluble nutrients, there's even some vitamin D there. Okay, but there's better ways to get that. Okay, now, for instance, legumes and whole grains are great sources of magnesium and other minerals. Okay, but many foods, even whole plant-based foods, are grown on soils today that are nutrient deficient or mineral deficient in particular, because your plants can't make minerals through photosynthesis like they can vitamins. The minerals have to be in the soil. So that's why you want to grow things in soil that are mineral replete, right? And that's how you get foods that are rich in minerals. But that's another argument for supplementing minerals appropriately to keep your immune system strong. Right? But the problem with a carnivore diet or a diet that focuses on meat is that while you're getting the benefit of getting rid of the other junk, it's, as I said earlier, it can be really hard on the kidneys in particular. Okay, and a lot of people have chronic kidney disease, a lot. In fact, the majority of adults over the age of 60 have chronic kidney disease. Many don't know it. And there's no question that meats promote that in general. So we at least want to be cutting back on those. And so the goal, even let's just say you're convinced that you want to eat meat as a main source of your diet. Even if you're convinced of that, you want to optimize non-starchy vegetables like carrots and spinach and all kinds of non-starchy vegetables. Now all those things aren't for everybody. If somebody has an oxalate, I saw a question on oxalate. If you have a real big problem with oxalate, then don't eat foods that have high oxalate, right? That's you got to adapt to what works best for you. But in general, if you're not eating multiple servings of non-starchy vegetables a day, you're not going to be healthy long term. There's no question to that. That's critical for the brain. That even Dr. Bredesen, says if you're going to eat meat, eat it as a condiment, not as a main source, because when you eat meat as a main source, it's actually bad for the brain. Because you got to have non-starchy vegetables in your diet. That's what sets the basis for most nutrients coming into your diet. And so I have patients that come to me, they're like type 1 diabetics, and they're on a carnivore diet because that's the only way they can keep their blood sugars under control in their mind. So I said, okay, well, let's at least start bringing in some healthy non-starchy carbohydrates. These are carbohydrates that only have 5 grams of carbohydrate per serving, as opposed to 15 or more grams of carbohydrate per serving. So make sure that you have healthy, low carb foods, that the non-starchy carbohydrates in your diet. And most of us, okay, once we are metabolically healthy, actually need starchy carbohydrates, legumes, and even whole grains. I used to run marathons. Okay, yeah, I actually had to eat 10,000 calories a day to just maintain weight. Okay, just to keep my energy levels up because I exercised a lot, especially in my 20s. I ate a lot of calories and I had to eat a lot of starches or else I was actually not do well and get sick. I'd get immune deficient if I didn't have enough calories. Okay, so everybody's different, but most people, especially my age, they can't eat that much carbohydrate calories because if they do, they'll actually have higher blood sugars. They need to moderate the starches in their diet by focusing on legumes and those type of starches. Okay, as long as they're avoiding the refined starches, they're usually going to be okay with some legumes in their diet. That's what I would recommend.
Excellent. Excellent. Thank you for that. Anything that's essential needs to be taken every day. Thank you, Raymond. Very good. Anna's Adventures says hello from Wisconsin. Space Girl gives us the thumbs up. And we may be out of questions and shout outs. Jeremy, are you taking us home here? Dr. Youngberg has been a real delight, very generous with his time and insight. And there again is your QR code to consult with him to improve your health, and worth every dollar of it, I can tell you that. So I hope that folks have picked up a thing or two about cognitive health and then about health in general. We got more than we bargained for today. I just praise God for clear thinking MDs, practitioners, researchers who care about people and will say the truth, even if it's not popular. Oh, there's another one, the 7-day detox course with guest Barbara O'Neill. That one is an excellent, excellent Christmas gift as we're heading into. I can't believe I'm saying it already. Give that one to a family member to go through the detox course, kind of like that one Dr. Youngberg mentioned called the Diabetes Undone. That's a good one too at the Youngberg website. What did you want to say there, Dr. Youngberg?
So I wanted to clarify here that my training, I have a doctorate of public health in clinical preventive care. It's basically a program that was training lifestyle medicine experts. We did our classwork with the other health professionals on campus at Loma Linda University, like taking pathology with the medical students, taking all our our biologic sciences with the health professionals and other disciplines. So I just want to clarify, I am not an MD. I specifically chose not to do that because of what I wanted to specialize in. I wanted to specialize out the door in lifestyle medicine and nutritional medicine. That's why I got a master's degree in nutrition specifically. And I just want to make people can look at my bio and they can see, all my training and my specialties on that. I wanted to make sure there's no question about my credentials.
Yeah, I misspoke there, so I'm glad that you clarified that. But I think it actually gives the opportunity to show a greater and wider knowledge base and expertise than a narrow, field of study. And folks, they see the proof is in the pudding as well. So thank you again, Dr. Youngberg, for being our honored guest today. And thank you to each and every participant in the LSR Lives and the LSR community in general. And thanks to our producer, Christian Digital Network. From likes to lives changed, scan that QR code, subscribe to their YouTube channel for content like this. And we'll all see you all next time. Our guest next week, I think, is about to be placed on the screen to announce for the world. And that is, yes, I'm your guest. I should know that, shouldn't I? We're going to discuss media on the brain. Your host and guest will be one and the same person. So we'll be talking about the effects of media on mental health, on family life, on the way that we think. And so that's been my specialty over the last 10 years. I've had the privilege of speaking at nearly 500 churches over the last 12 years or so now, but doing more things digitally now, so I get to be with more people at the same time. So we'll see you then, November 6th, 7 p.m. And follow Dr. Youngberg. What's the URL again, one more time?
What?
What's your
dryoungberg.com.
URL?
That dryoungberg.com is my website.
There we go. dryoungberg.com. We'll see you all next time.